Hi, everybody. It's David Porter, and I'm here to talk about opiates. Opiates are strong analgesics. That is, they are drugs that are designed to relieve severe pain. They also produce euphoria, meaning they diminish one's emotional response or distress about the pain or the injury. Now, these drugs are widely abused. Uh, Users seek the euphoric effects of opiates, which, in the absence of severe pain, will initially feel orgasmic. The user will then get a very relaxed, drowsy, peaceful, warm feeling that will persist for hours. However, people will rapidly become dependent on these drugs, both physically and psychologically. Once your body adapts to the opiates, you'll become violently ill about 12 to 24 hours after your last dose. You'll experience uh, profuse sweating. You'll sweat right through your clothes, uh, severe nausea, vomiting till your stomach is empty, then dry heaves, diarrhea, abdominal cramps, splitting headache, goosebumps, chills, fever, watery eyes, runny nose. This will basically feel like the worst flu that you've ever had by multiplied by many, many times over. And all addicts have to do to relieve that feeling is put the needle in their arm or snort another line, and all that physical illness I just described melts away within seconds. Um, Before the plunger of the hypo even goes all the way down, all those symptoms will just melt away and it will feel like you've never been sick. And unfortunately, this cycle will repeat itself every 12 to 24 hours. This is the hell that addicts put themselves in. Uh, Opiate addicts care nothing that the heroin they bought on the street may be cut with toxic compounds or drugs which are designed to sedate large land animals like elephants, drugs that will kill a person within seconds. Opiate addicts tend to be pretty fearless about what they put into their bodies. So today, what I want to discuss are some uh, very a very potent opiate, which is relatively new to the drug scene, and a couple of extremely potent opiates that are being used to cut heroin, which has resulted in multiple overdoses. Now, the primary danger of abusing opiates is overdose by respiratory depression, or which I should say will produce respiratory depression and result in cardiac arrest. This can occur within seconds of injection. Uh, when opiates are used, they cause depressed respiration. They slow your breathing down, and the person will take short, shallow breaths where the lungs will not inflate properly. And opiates will also shut off the alarm system, so to speak, in our brains, which will tell us when we're in respiratory distress, when we're not getting enough air, that will tell us to take deep, strong breaths. So the person will basically lose all respiratory effort and lose consciousness. Their heart will slow down. Their breathing will eventually stop. Their blood pressure will drop, and they will go into cardiac arrest and die. And again, this can occur very rapidly. Other dangers of abusing opiates are from the liquid medium or the whatever is used to dilute the heroin, put it into solution, put the heroin in solution, so that it can be injected. Because heroin, of course, is a white powder, and OxyContin, Percocet, Vicodin, Loracet, Roxacet, Dilaudid, any prescription opiate can be crushed, mixed with a liquid medium, and injected or crushed and snorted. So ideally, the liquid medium should be distilled water, sterile water. And addicts are not going to take that care. Maybe they will at first when they're first getting into their addiction, but as they progress further and further, caution is going to be abandoned, and they're going to take increasingly high risk, uh, engaging in increasingly high risk behaviors with their use. And this will include doing things that are just absolutely appalling, like mixing the heroin with water from a mud puddle, a toilet tank, with their own urine. Eventually, they'll progress to that. Even using water from the faucet to mix heroin is dangerous. Water contains microorganisms that our stomachs can kill. So it's municipal tap water is safe to drink. Okay, at least in most cities. I know we could argue that point, but tap water contains microorganisms that will multiply when put into the circulatory system, the bloodstream, and this can result in local infections at the injection site, abscesses, which can progress to the point of gangrene where limbs have to be amputated. The other possibility are very severe fatal heart infections, myocarditis and pericarditis, infections of either the membrane sac around the heart or the heart itself, or endocarditis, infection of the heart valves, chambers of the heart. These are potentially fatal without prompt treatment. And of course, the other big danger from using dirty needles, needles that have been shared, is HIV, human immunodeficiency virus. It's a bloodborne pathogen or disease which will lead to acquired immune deficiency syndrome or AIDS, which is 100% fatal without treatment. Now, heroin is never going to be sold in its pure form. It's going to be cut with low cost, inert ingredients which add weight and volume to maximize profits for the dealers. And this could include uh, relatively benign substances like baking soda and confectionery sugar, uh, mannitol, which is a infant laxative, and it can also include things like strychnine, which is rat poison, ground glass, because it's relatively heavy, and the concern that we're going to be discussing today is are much stronger opiates like fentanyl, such as fentanyl and carfentanil, which are used to cut the heroin. The dealer will cut the heroin with inert substances, and let's say this is how to maximize profits. They bring it down to about 5% purity, which is not going to be enough for most addicts. It's going to be too weak. So they'll fortify it with a very, very small amount of fentanyl. This will bring the strength back up to around 10 or 15% while costing the dealer very little money. Now, fentanyl is 50 to 100 times stronger than morphine, so it won't take very much. And then you have carfentanil. Carfentanil is a large animal veterinary sedative and analgesic or painkiller. This is a drug designed for rhinoceros, elephants, hippos, bison, the largest land mammals. Uh, it's very difficult to disperse such small amounts of fentanyl and carfentanil in a batch of heroin. There are going to be hot spots, so to speak, throughout the batch of heroin. And this is how people overdose. It only takes micrograms, that is, 1 millionth of a gram, to overdose on carfentanil, and it doesn't take much more to overdose on fentanyl. Because, again, fentanyl is 50 to 100 times stronger than morphine, while carfentanil is 10,000 times stronger than morphine. Even large animals like elephants only get about 12 milligrams of it. That's all they need. That's all they can handle. And there are no long-term effects from using carfentanil. It, the drug is so potent that it will lead to respiratory depression, respiratory failure, and cardiac arrest. There are no long-term effects because the user is going to be dead. Carfentanil is so potent that if it's inhaled or gets on your bare skin, it can result in an overdose. Drug-seeking canines, narcotics dogs, cannot be used to detect uh, fentanyl or carfentanil. Just smelling it can kill them. Police officers and medical people, corrections officers, should not handle anything that they suspect is tainted with fentanyl or carfentanil, because even if you get the stuff on your bare hands, that can result in an overdose. So this is a danger to first responders, ER staff, law enforcement, corrections, as well as the user or family members of the user if they come to the scene afterwards, after the overdose, that is. There is no safe amount of carfentanil. Now, another drug that warrants mention is Crocodile. Crocodile is a very popular drug in Russia. Crocodile is made from codeine. Now, codeine is a weak opiate, which is readily available in Russia over the counter, as I understand it. And when codeine is mixed with gasoline, red phosphorus, and iodine, it yields what's called desomorphine, which is comparable in strength to fentanyl. It's, again, 50 to 100 times stronger than morphine. There is, however, a very severe side effect from using this drug. At the injection site, it will cause the skin to become very dry and hard and scaly, like a crocodile. Or in Russia, in Russian, the word is pronounced crocodile. That's where the name comes from. If the user continues using the crocodile, it will produce necrosis or tissue death all the way down to the all the way to the bone. It will be result in very grotesque, disfiguring scarring, very painful, very infected tissue, which can proceed to gangrene and typically results in amputation of the affected limb. So, fentanyl, carfentanil, crocodile, these are three dangerous opiates which are available. And crocodile, although it has originated in Russia, there have been confirmed cases of it showing up in Manchester, New Hampshire, Kansas, Florida, Illinois, and Arizona. So it's not by any means widespread here yet, but it's here. So thank you for watching. I hope this was informative. Please hit subscribe and keep an eye on this channel for more videos about addiction, mental illness, uh, also information about criminal psychology and forensic psychology. I intend to develop this channel and put up a lot more videos, so please check back again. Thanks for watching. Okay, now, how do I turn off this camera? Here we go. All right, everyone, have a good day and be safe. Signing off on 3, 2, 1.